Thank you very much. I do so appreciate you, your just cooperation and flexibility in indulging us. My colleagues know, Mike's right, with 4 days in Albany, it's tough to meet everything, and I think many in this room know I have the only bi-borough assembly district in the city of New York, so I get to traverse that bridge lots of times in one day. But in any case, I think it is important that everybody in the room know that as devastating as these cuts are, and as dismal as this budget is, your needs and your desires are not lost on us. If there's one thing that I can say about the dean of our delegation is that Mike has led us in a wonderful direction with his expertise in history and mental health. He actually has ensured that this delegation fully understands your needs and the concerns of the mental health community. And I can say that as a relatively new legislator, he's been an amazing leader in this arena. So I can assure you, your delegation is well prepared to deal with the challenges. As I briefly covered your packet, I want to say one of the things I was most impressed with is your recognition of how dismal this budget is going to be. And I dovetail that because you have made a packet here which allows us to focus on some priority areas where we can focus on options that don't require direct funding. And I think at this juncture, that's where we as your legislators can be the most help. And you've clearly assisted us with putting this in here. I'll address one thing in your packet, and that's the Office of Medicaid Inspector General. This is a conversation we are having in great detail in our conference, and I think Assemblyman Cusick and Jatone will chime in with that. We recognize through ourselves and our colleagues in government that the intent in the Office of the Inspector General is probably gone astray, and gone astray in a negative and disingenuous direction. We understand that, and I can tell you we have made this clear to our leadership. Our colleagues in government have made it clear to our leadership, and we've shared with them very specific stories of the disastrous effects that this Office of Medicaid Inspector General has had. So your packet, believe me, it resonates with us, and it is a conversation we have had, and I think if we can give one positive thing at this breakfast, this is an area I think we will see some substantive changes in. So that I can give you some assurances there. Having said that, I'm going to be quiet so that my colleague Matt can chime in. And please understand, while we all have different legislative agendas, and we're all working on different facets of our quality of life on Staten Island, you'll hear from each one of us some aspect in our legislative priorities and agendas that deal with mental health. Certainly Assemblyman Cusick with his new role as chair, my commitment with my new package of legislation on autism, and Matt has some wonderful legislation dealing with the psychiatric beds and children, which I'm sure he'll tell you about. So I think that should be encouraging to you that each one of your legislators so intimately knows your concerns that we've made mental health in some capacity a priority of every one of our agendas. So while I can't stay, and I know that seems disingenuous, please know my heart and soul rides with you and sides with you on the issue of mental health. So thank you very much.